Hello, welcome to our frequently asked questions. Today I'm answering a question about blepharoplasty. What is blepharoplasty and how can it help me? This is a common question that many patients ask me. My name is Dr. Julian De Silva and I'm a London-based facial, cosmetic and plastic surgeon. And blepharoplasty is one of the most common procedures that I complete for patients on a daily basis. And about 20% of all the patients I treat are patients who've had surgery elsewhere and are revision patients. And I have a keen interest in educating patients, educating other doctors, and hence I hope this video is useful for you. So what is blepharoplasty? Well, blepharoplasty comes from a Greek word, and blepharo means eyelid, and plasty means to change. And so literally blepharoplasty means to change the shape of the eyelids. Well, generally when we talk about blepharoplasty, we're talking about a surgery to improve one's appearance. And that may be through aging, or it may be through a combination of aging and genetics and what you've inherited from your parents. And so if we look at upper eyelid surgery or upper blepharoplasty, the commonest changes or symptoms that you can notice in the upper eyelid tend to be a combination of a looseness of skin and a drooping of the appearance of the skin in the upper eyelid. Sometimes this can also be added to by some of the fat that usually surrounds your eye coming forward. And you see this as a bulge in the upper eyelid towards the side of your nose. And a combination of a looseness of the skin, some of this fat coming forward as a bulge, often gives a more tired appearance to your eyelids. As I mentioned, all changes are a combination of your aging and also genetics. And some people will have more changes at a younger age and some people will age better. Now in the lower eyelid, what can be a little different is you tend to have a cushion of fat that is usually there that protects your eyes, but with aging some of this fat can come forward and creates a bulge in the lower eyelid, and this is often seen as fat bags and creates a more tired appearance. And often patients will describe friends or colleagues asking, are they tired, are you not sleeping, or other issues relating to the appearance of these changes. And although mostly people attribute these changes with aging and tiredness, I have many patients who are younger, even in their 20s, who've had these bags even since their teenage years. And of course in these patients it's not really aging, it's really genetics. So we've talked about some of the symptoms that can occur with eyelid changes. What can be done about this? Well, eyelid surgery or blepharoplasty is about reshaping and rejuvenating your appearance. And so upper blepharoplasty, well, this involves removing a layer of the loose skin, and if there is fat coming forward, it can involve either reshaping or removing some of that fat or relocating the fat elsewhere in the eyelid. Overall, the principle of upper blepharoplasty is to smoothen out and reshape the upper eyelid and to create a more fresher appearance. And this contrasts with the lower eyelid or lower blepharoplasty, where changes in the eyelid can be, the surgery can be completed in two principal ways. Historically, the surgery has been done through an incision in the skin. In medical jargon, this is termed Trans-Cutaneous surgery. And although the surgery is effective, it does result in a scar and can change the shape of the eyelid. A more contemporary way of the surgery is to do the surgery on the inside of the eyelid, and in medical jargon this is called Trans-Conjunctival lower blepharoplasty. This is certainly my preference for most patients, as this avoids scarring of the lower eyelid and often has a very fast healing without any of the disadvantages of the scarred technique. However, still in many parts of the world the surgery is less common than the surgery through the skin. So we've talked a little bit about the changes that you get with aging. We've talked a little bit about the changes that can be improved with eyelid surgery. The other important things to consider are you and your general health, and there's certain factors with your health that may influence blepharoplasty. And the kind of things that are important include whether you've had laser refractive surgery in the past, whether you have dry eyes, whether there are other factors such as glaucoma or thyroid eye disease. And for most people, these factors are going to be less relevant, but for some patients, these are very important. And with every patient, it's important to take these other medical criteria into context when looking at blepharoplasty. The other consideration is, well, everyone's eyelids are different. And so when you look at your friends and family members, you will see great variation in the shape of your eyes, the size, the qualities of the skin around the eyes. And the eyes are very delicate. The skin around your eyes is less than 1 millimeter in thickness and doesn't hide even the slightest imperfections. So it's very important to consider your particular ethnicity, the shape of your face, your particular qualities when considering blepharoplasty. So, in summary, I hope this has been useful for you. We've talked about the various changes that can occur in terms of eyelid changes with aging and also genetics. We've talked about what blepharoplasty means and what the surgery involves. And we've also talked about how unique some of these factors are. And although blepharoplasty is generally regarded as a surgery that improves your appearance in the upper and the lower eyelid, there is a lot of variation in patients' appearance, and the eyelid surgery certainly needs to be modified for each person in order to give you the best possible result. I hope this has been useful for you. Thank you for watching.